from the masters, and nothing added by me or something more clause or the basic tenets, nothing to be disturbed, and by practicing on that line we get better results. Very simple way the things will be put up today, how the difficult looking aphorism converted into understanding of the application of homeopathy and finding the results in the most difficult autoimmune cases. So the next one, decoding of homeopathic science. Why it is decoding? The topic name today was kept as decoding, because the organ aphorisms, what we see usually,
it is very coded.
Very coded. It doesn't look like that we can crack that code and you come to the conclusion and how to apply it. And you'll see the exact example and how that's decoded. And after decoding, when you apply, even if you are not a homeopath, you will get the result. And surprisingly, before 1947, homeopathy was not institutionalized. In 47 or 48, it was law passed into the parliament that homeopathy was institutionalized by Dr. Saxena and promoted by Dr. Kaur or somebody relative to him into the parliament, and then it came into practice as a organized and the formal education. The colleges which we see, more than 100 colleges today into the India, that came in existence after the independence. So before to independence, and from the introduction of the homeopathy from Calcutta and elsewhere into the Indian subcontinent, it has flourished without such colleges, without such formal education. So why and how it had survived? And why today we are finding too much struggle as a homeopathy to survive? You will listen to every one of your partners. अभी तो ये सब culture ऐसा हो गया, इसमें कुछ होता नहीं है. No new generation or new talent is coming in, and how it will. So that time there was no formal education. There was no known talent कि ये इनको आता है homeopathy, ये देखो. But even then it was producing results, and that is why it was propagated. Things which cannot produce results remarkably cannot become popular, because you are dealing with what? Life and death. Health of a person. It cannot survive. It has survived. So why and how? Also that will be answer to, you will get the answer why it was doing it. Next we will see. So the basic history taking which we take in formal education, that will be going. We are not destabilizing anything. We are just adding some basic part into that how to get the remedy very fast, very often, without looking into that too much of digital repertory. We are spending too much of time and not getting any remedy out of it, and they are fumbled thereafter. So the Hahnemann has this, and that which aphorism has been saying that location, sensation, modality, and concomitant. This is very easy, all three first. Location you know very well. If it is psychiatric also we know it is mind, and if it is the tissues, any part of the body, then it is a location. Sensation, what kind of the sensation that patient is suffering from, what kind of a pain, for example, sudden pain, slow growing pain, discomfort, heaviness of stomach, heaviness, tingling, numbness, everything you know sensation what means is by. So second is also very easily understandable, that is sensation. And third is modality, a disease modifying factor, either it is aggravation or amelioration. And in modalities there are two modalities. One is the circumstantial, that is by lying down you are aggravated, or by walking or movement you are ameliorated, something like that. Second and most crucial is the time modality. That's very crucial, and more important to any case it can add to the value of that. Time modality when it is specific and particular. Last is what? Hahnemann added that. We have been taught throughout our college. And that is what I am saying. You are very frank to answer that Hahnemann has not said it. But yes, he said it very boldly, but in a different way. That is why I said decoding. Now let's see what is the code. Next. So in Herring's, if we have the book here, in Guiding Symptoms, and the first introduction page, he writes that after this is Hahnemann's over, and then Herring's schema. Herring is written in a different way. He was given a like crisscross. Same localities or tissues, then sensations, that is the same, then conditions, better or modalities, conditions of better and aggravation. And fourth is concomitant. Herring used to say that even if you get 3 out of 4, you can get the remedy, and your patient is going to get cured. How to get the history? History taking is completely different in homeopathy, because you have to find what? You have to find the totality. Totality means what? The individual patient has to be differentiated, and then individual remedy will come. And then only then you will see some cure process happening. Is that it? So next is. So let's decode. Aphorism 95. We'll read the Aphorism 95. One of you can start reading.
Diseases, the investigation of the signs of disease above mentioned and of all others must be pursued as carefully and circumstantially as possible.
So here we try to understand. Above mentioned. Above means before to this aphorism. Up to 95. If you remember, by 82 after he starts writing how to do the individualization. And unless you do individualization of the case, it is nothing going to happen. No cure process will happen. To get the cure, you have to individualize each case. And after that he writes this. So we have done this. You are very good, nice case taking. Everybody knows now. Everybody is experienced. They are doing homeopathy. So they have done very pursued carefully and circumstantially in all respect. These that you have taken the whole history, that four, that is location, sensation, modality, and concomitant.
And the most minute peculiarities must be attended to.
Yeah.
Partly because of these diseases, they are the most characteristic and least resemble those to acute diseases.
Yes.
And if a cure is to
Yeah.
though cure is to be affected, they cannot be too accurately
Noted. So if you can understand any of this particular part, I can give you that 95 to you. You can understand, because that is why I say why the decoding, because once you get the habit of reading organ, you will understand the best of it. They cannot be too accurately noted.
Not be too accurately noted, partly because the patients become so used to their long sufferings
Yes.
that they pay little or no heed to the lesser accessory symptoms, which are often very pregnant with meaning, characteristic, often very useful in determining the choice of the remedy, and regard them almost as a necessary part of their condition, almost as health, the real feeling of which they have well nigh forgotten in their sometimes 15 or 20 years of suffering, and they can scarcely bring themselves to believe that these accessory symptoms, these greater or lesser deviations from the healthy state can have any connection with their principal value.
Yeah. What is the message, if you can say?
So there can be some symptoms where a patient is living with it and he does not consider themselves as a problem.
Yes.
Which can be one of the main reasons for the disease.
Yeah. Anything else? So we have underlined two places. First, VD1, upper one. The most minute peculiarities must be attended to. अभी ये minute peculiarities पूरा history में किधर भी अनुमान नहीं होता है. It is not been understood by. So we don't know which is that. You have taken carefully case taking done in all circumstances. The whole case is taken. Now still he says you must, because this is going to be your decision. If you decide remedy on that, that will be the remedy.
So does he mean the observation which a physician makes?
Yes, observation is one of that.
Some habits or some
Observation is one of that. Yes, that is observation.
clinical signs.
Clinical science is that, you see, also can be one of that. Yes, very well. So minute details. Now here it's very vague to appears to us. It is very vague. And you see the last one. In acute it is very obvious that you get this, the signs, symptoms, history, patient's memory is also very sharp. There is a very recent one. And the chronic, it may be 15, 20. We have seen even 50 years old diseases. They are coming to us. So he doesn't remember. So you have to find out what is that minute detail. So importance is of minute detail. Second, lesser accessory symptoms, which are often very pregnant with the meaning, often very useful in determining the choice of the remedy. This is very important. He says this is very important. And what is that? Accessory symptoms. What are the accessory symptoms? That is why I said I gave the name of the topic as decoding. If you understand that what are the accessory symptoms in the history of every patient, the case gets solved. You don't need even repertory. In acute, you get very simple, very accessory symptom. I'll give you the example. Last time we were discussing the colchicum, for example. So and even by the NASH, and we have also the experiences. Those who get severe nausea of food being cooked, and they can't stop vomiting. That doesn't seem to have, in acute, yes, you find that remedy, and that remedy gives excellent cure. It cannot be explained pathologically why these symptoms are coming up. Somebody said that he may be, the olfactory may be very sensitive, so he is feeling like that. But that is individuality of that patient, that very sensitive to that smell of cooking. So that makes the remedy, and you give the remedy. So that's a very small little it appears, and that is the accessory symptom of that particular patient and particular remedy. When these two are together, then you get the results, 100% results. This is what I am saying, accessory. Accessory means what? Accessory, that is what the problem is. We haven't read this because he says the remedy comes, determining the choice of the remedy comes here. If you know what is accessory symptom. Get my point? So decoding क्या करना है? ये code ही लेंगे भैया. That is right. Minute detail and accessory symptom. What are that minute detail and what is that accessory symptom? That's the. Now, if you get any clue, I'll give you the one example, isn't it? You want to read somebody? Aphorism 95 again.
Again,
You want, if you want.
in chronic diseases, the investigation of the signs of disease above.
So, especially in chronic disease.
Chronic disease.
So you have taken the history, as he said, you are taking history, carefully, punctual, circumstantial, everything is done. When this is done, what is more important is you have to pay attention to minute detail, ek one. And number two is that patient may not remember. He may consider that whatever is associated complaint he has, accessory symptom, is as good as chronic ka part. It is a part of the health because he has been living with it. He may not mention it to you. So then, what is it is our responsibility to find out what is that accessory, what is that minute detail, and how to find that, and how to find the remedy accordingly. That is our job. So let's see now. This is, we are done with 95. Is it okay with you? Got the idea? Now let us decode it. Few cases here we all put right here. If you have any detail of the case, small. कितना एज था इसका? ये 3rd January का डाला. First. What is 3rd January? First. Yeah. So he came with this severe. In case, if you can narrate the case, छोटा सा, 1 or 2 lines. Dr. Trupi, if you know the case here.
Comes with rheumatic pains and chronic iridocyclitis.
These are the case, and such a severe that he had been to for years together to a rheumatologist, different rheumatologists. And as you know, the latest biomedicals, that is methotrexate, lefluno, SARS, painkiller, steroid, these are the proper remedies, isn't it? And he was on that. And he had the job of working on PC, that is share bazaar ka work. He has to concentrate on figures and very sharply he has to. He could not do it. And whenever this comes, he goes to eye specialist. So 2 pathies are involved. There are 2 specialists are involved. One is rheumatologist, second is ophthalmologist. सबका remedy एक ही रहता है इसमें. Now see the sarcasm of the today's that now they are going back to the autoimmunity. Both are giving same medicine. Eye wala and rheumatism, because the basic disease is back somewhere and the expression is here. That is what I am saying. Explain it to every one patient of mine. Whenever they come with the skin, I said this is not a skin disease. So you are suffering since last 20 years. अगर स्किन का हल्का भी का निकल जाता है छोटा मोटा, हाँ मुझे भी लगा ये कुछ अंदर का है गड़बड़ी, ये जा नहीं रहा है. So अंदर का गड़बड़ी, then we prove it with IgE, or whenever it is possible, whichever the test is possible, then they get the faith. Then I put the Hahnemann's theory that it is not the skin which is disease, it's the person that is inside you, something is wrong, and that is reflecting the disease outside, and this is the part of follow. So whenever they see, they are also wanting to see that ये जा रहा है उसका मतलब कि अंदर का गया. Now he is concerned with this such a red eye. He cannot open, cannot work. Photophobia is so immense. This light का torch गया ना अंदर. He can't. Watering like anything, itching, burning, and constant iridocyclitis next. Yeah, 3rd of January. That is when we started. He came with such an acute.
This is afterwards.
After.
21st March.
That is 21st of March. That we have, there was continuous follow-up. We have large number of photos, but when we started actually seeing that he started appreciating, then he said that my this right eye is severely affected. But this eye was quite well, so he was carrying on with his work. That is in end of March. Yes. That's what it. Next. That's the right eye.
And this is 11th of April.
April, May. Yeah. Right again. So this is going on, and this is what the finally he came with. But then with this, along with that, his different joint pains, which were along with that, slowly getting clear, edema of the feet getting clear. Joint pains are very solitary, 1 and 2. It was already all over body. Only 2 joints are remaining. Now when this case was trying, do you have this history? कुछ है छोटा मोटा?
I don't think so, but I can open the case.
नहीं जाओ there. So the accessory symptom. Now here comes the analysis. The accessory symptom, how to find, where to find. Now we find out through the last writing which you have prepared. How to construct and how to find the accessory symptom in each and every case rather. This is a very chronic case, already dependent on multiple medication. By the time he is on the photograph which you saw, he was almost discontinued on all autoimmune diseases, no painkillers so far. After the first month he started distributing, he started getting some confidence, abhi problem nahi aayega. So he started reducing himself, and that in the last month of April, he has given up all the medication, only on homeopathy he was on. So this is the TPBs, Therapeutic Pocket View, the most unread book, I suppose. Any idea? Lastly, we show them the more picture. Last. This is the book. This book explains what is that minute detail and what is meant by accessory symptom. And so very clearly that particular classical one point which I am going to describe with us to you today, that will tell us what is meant by accessory symptom. Accessory, yeah. So he is the T.F. Allen, and T.F. Allen was in 1935. He again compiled the book of Boeninghausen, and the book, he says the therapeutic pocket book for antisoric remedies, and then non-antisoric remedies. So one of that is on the 17th page of this book, he has written this. So how they used to find that everything, which one has to be very clear about homeopathy. What is the difference that Hahnemann found out? He was a pioneer in proving the drug. Before giving it to the patient, it has to be proved on the patient. So the pathogenic power of the medicine must be known. What patient is suffering is different, but what medicine is going to do to a patient, how it is going to cure. So pathogenetic power is proving. So everything starts from proving. When you start reading these people, everything starts from proving, and every application comes from proving. Every remedy, the knowledge and the application, everything is from proving. So he writes from that same angle. Symptoms appear in constantly varying combination in proving and in sickness. So one person with the iridocyclitis or the rheumatism will have a symptom different, another will have a different. So ultimately all the rheumatism, let it be ankylosing, let it be autoimmune, let it be uric acid, let it be RA. Ultimately everything comes in one group, that pain is here and that pains are in connective tissue or joint pain or connective tissues. So he had, along with that, added is connective tissue. The form which symptom may take in given case is governed by peculiarities of individual. So combination it gives in proving and as well as in patient, individual. The group of symptoms, therefore, the personal equation rules in every individual case. So every individual case has some personality and they exhibit in a different way. Symptoms are expressed in a different way. All cases of rheumatism, for instance, will present the certain symptoms in common. As I told you, every Rheumatism has one, this common is joint pain. Either it may be here, it may be there, or it may be all, or it may be only the muscles. So we have the rubric also to those who have articular rheumatism, muscular rheumatism, or it is the iridocyclitis, different, what we saw in the case. So all cases, yeah, there are symptoms in common diagnostic symptom. That is makes the broad diagnosis of rheumatism. Is it clear? Now from here you have to find out what is that small clue or what is the exercise. Next. Besides this, the common symptom, each case will present what Hahnemann calls uncommon, peculiar, characteristic symptoms which represent the individual factor in this case. This is the exercise. Every rheumatism is different, has a different part of, and I have treated in the similar line, even in my earlier case, I can recollect it because at that time I was not reading this TPB, very early case, because if we were not introduced, this is not in our syllabus. This so important book is not in our syllabus. How to find your remedy, a most practical book is this. So, yeah. Symptoms which differentiate it from the other cases for this class, the symptoms vary in every case. And that is the exercise symptom. This case which I have been seeing this right now, eyes apathy, was suffering from so long, and surprisingly such a simple remedy has come up. And adding to that, what we have to do is now again go back. Location, sensation, modality, concomitant. Now you don't get every patient with iridocyclitis. Got it? You don't get. And they are very severe cases. Go back to the analysis again, what Herring has said and the Hahnemann has said. This slide which was there. Yes. Again coming back here. Now if you can make one grand symptom into this, and that will fit the whole case. That is what Hahnemann used to say in 95. And that is what the Boeninghausen said. And this book, Therapeutic Pocket Book, is wholly based only on that. How to form a concomitant. This fourth one, which we are not tuned to, we are not exposed to, which we are not trained to. And that is what the Boeninghausen book is. And that, if you read the Boeninghausen book, and again it is written in a very coded language. He is the preface to Boeninghausen, he has written the preface to his own book. It is also there. But if you read that, it's very again a coded language. So you have to be very concentrated, read again and again, then you realize. But Allen has made it very clear by giving this example. This example was given, the rheumatism. How this particular small clue has given a clearance to so many cases which I am doing. Very easy, very fast. And you see that such a case, another case which I would like to say here, a boy, a man of around 45-50 was walking like this. Every time. And since last 5 years. So when they don't find, because the usually as you see the allopaths, किधर है? कोई बात नहीं. So he was a male and looking at the pain, severe pain so much that he could not go to job sometime. He had to take leave. And the emergency में एक बार तो hernia का surgery भी हो गया. But still he was walking like this. Because the painkiller is going on, he is fine. Again the painkiller is gone, he is walking like that. So arrive at diagnosis, because nobody had done the diagnosis before to us. Like the patient either घूम के आया, that it is known that he has so many patient paper with them. But this was not diagnosed. Again, all the tests are done, it is negative. Now this was what? Clinically also very important. So every patient has to be examined. Clinical diagnosis is essential. Every time it is essential. Isn't it? So this boy, this man rather had the rheumatism of abdominal muscle. Very tight. You can't put the hand. The moment you put the finger is like that. So CT scan, sonography, MRI, everything done repeatedly. Nothing is wrong inside the abdomen. Nothing is wrong. Somebody treated for the testicle torsion. जिसको जो चीज समझ में आया सब कर लिया. 7-8 years. He came with the same walking. Feel again then. And it may such severe cases may take few more weeks to respond to you. So only one remedy which is there known for abdominal rheumatism. This is I am saying why this is not a keynote practice. He had rheumatism, diagnosis was very difficult, and that man started walking straight, and that tenderness went off. Only one remedy. You will be surprised to understand. Phytolacca. Phytolacca has the abdominal muscle rheumatism. That after that I started applying with the Kinjal Purohit. Kinjal, શું નામ છે? પુરોહિત. સવારના આવે છે. મનીષ પુરોહિત, મુકેશ પુરોહિત.
હા હા કિંજલ એની ડોટરનું નામ
Yeah.
છે.
So she is a lady of about 55 again. Chronic pain. कुछ नहीं आता, कितना इन्वेस्टिगेट किया, मतलब इसको कुछ मत करो, नाउ गिव फाइटोलेका से उसका पेन गया 3 weeks. Chronic pain, nobody could understand that why there is a pain in left iliac fossa. One patient I remember, because after treating this about 10 or 12 years back, that patient had that pain for about long number of years, always complaining pain in left iliac fossa. That lady, then we could not understand, फाइटोलेका जमग में नहीं था, टीपी भी नहीं था उस टाइम पे मेरे पास, अंडरस्टैंडिंग. She went later on with the rheumatism all over body. Same disease was there, just like a seed, and that flourished all over body. And she could not be controlled. Later on, I remember that when I started getting results with Phytolacca, then I realized that this was that, and that it turned into. That man was about to get it all over into the body. First he started in abdominal muscle, rheumatism. Everybody is fumbling to find the result in this case. And see the master plan here, that every patient with rheumatism comes with same set of symptoms, but something differentiating, small thing which differentiate. Here the abdominal muscles, and only remedy. And there is nothing that you have to do, only one thing. And then again go back to our plan, location, sensation, modality. Again Phytolacca, you'll see the modality, similar modalities. And the concomitant is the abdominal muscles, into the muscles of the abdomen. It appears like that, but that is the something. And when you give that remedy, all parallel or associated, accessory symptoms also get disappeared. That means this remedy is defective, number one, and this remedy is the anti-miasmatic for that person. So Hahnemann used to say, unless you give anti-miasmatic remedy, your cause is not going to get solved. So that is the power of this kind of understanding, applying the accessory symptom. That is very important. Next we go to the concomitant application. Am I getting clear what does the mean to say by the rheumatism? And one rheumatism you have to apply, find out something which is different. So here I applied what? The case which I show you. Redness of eye and the man, which was on all the possible remedies. If about 10 years back, this man would have come only with the steroid. Now the biological has come into the market, so they have all the biological. And HU case was also available there. So in olden days, we used to get the patient with steroid and HU case or quinine, third. Now they are with the biologics. So what could be the remedy? Now very simple differentiating factor, that along with the pains, deformity, you had deformance. The modalities were, again, you had all the things. Again going back to that plan, how to find? Going back to the plan, original plan. So Hahnemann has given concomitant from very early time. Only Boeninghausen could transform that into practical application. And that plan he has given so beautifully into the TPVs that Allens has explained fantastically, that you transform that, all of your cases, into how to transform that will be learning it. Again put into the same, ये दो आ गया सब केस में. When you get modality, how to find out that modality and how to apply. And one symptom may not be complete in every case. See, you take one chief complaint, it may not have all the four. You may see that even you start from your formal education, you start applying. एक patient में सब चारों चार नहीं आता है, तो क्या करेगा? How to get the results? How to make it practically possible? So that we'll see now. Yeah, go. This is done? Yes. So the first application, the Boeninghausen has published the theory of, or the rather, the book for anti-miasmatic remedies, pocket book for anti-miasmatic, that is for bedside. His application was in bedside. That was to help the doctors, because those days to materia medica pura, and there was no repertory. So he has to put something which is readily available on bedside. So that was the clue that he started making it. And he made that book, and that was endorsed by Hahnemann, and Hahnemann was also using his book, because that laborious task was done by Boeninghausen. And thereafter in 1935, this Allen's TPB book has come out. For this, nearly 1 century, this particular approach is tested by grand generation of previous generation of homeopathy, where most of them were gynecologists, surgeon, or some other MD doctors. They have tested this approach, and that is why this is the most dependable, most trusted approach when you want to get the deep-seated pathological cases का results. If I am trying to understand that because इतना beautiful, इतना practical book होके भी it is not in our regular studies. Next. That is what he says. Concomitant above all demands most thorough examination. That is what 95 also said, aphorism. That requires most thorough examination. Next. Is the doctrine of concomitant. How to study concomitant, how to find concomitant in each and every case, and then how to apply it. That is the most important thing. Recently, lastly also I said we made one case of the colchicum right now, isn't it? Colchicum, no? That nausea order, cooking order, and last time also I said that it was the Nash, the materia medica of Nash. And Nash said that I have experience only of this much application of colchicum. If you have studied the Nashka colchicum, and he doesn't find that he has not got the chance to apply it in cases of rheumatism. But we have excellent results with concomitant. Excellent, beyond imagination. We started applying. What is the colchicum characteristics? So again, I am saying that why homeopathy remained even before independence, because they were mastering materia medica. Drug which is proved, they are prior in application, and application they were mastering. Now here अभी आज का generation क्या हो गया हमारा? We are going for digital record. Single mark, single week, 3 marks, वो mark से जाते हैं, and single application में से जाते हैं. So that becomes that's not the materia medica. So what is the grand materia medica of colchicum? Now you see, start applying your mind. Whenever you get what? Colchicum के the grand feature of that remedy is the changing place. Changing very often. Changing from one place to another. That is, you can say wandering, shifting, yeah, that kind of the rheumatism it has. And it may be quick. It may be quick. That is today or sham ko. It may be 2-3 days, but it is shifting in the places. And the third part of that is rheumatism. It was colchicum. If you tell anybody, it is what? Nausea. Food ka nausea, or the pregnancy and nausea and whatnot. There may be jaundice, for example. The most very vital remedy of the rheumatism is the colchicum. These shifting pains, and such a shifting that most of them are in the tissues of the tendons, ligaments, and the muscles, not in the articular much. But it is also applicable in the uric acid, when it is very sensitive to touch, so much that it is excruciating, unendurable pain. Whenever in rheumatism, unendurable pain, it is a colchicum, one of the remedy. Acute, it is unendurable. Chronic, even if it remains unendurable, it is colchicum. So that is how the practical use and application of the colchicum happens. Next. So how to find what is first is mean by the concomitant. Very, very essential fourth part of our history taking, which is remained unexplained, unexplored, and unapplicable. वो समझता नहीं था अभी तक कैसे लगाना. And what is the after application? The first patient, if you remember, we have the red eye. We may come across, and I saw a number of cases because of that remedy. And if you can make the clue, if anybody of you, connective tissue, deformance भी था उसको सब कुछ था. The modalities were applied, and that was restless at night with pain, cannot sleep. Pain with restlessness, and better during the day when he is active. The pains were. It was Rostox was applied. It has cleared the iridocyclitis, which even not was getting cleared with steroids. 2 leftoin methotrexate. All 3 together could not solve his case. Such the severity of the case was, and that was being done by Rostox. So 2 remedies we saw now. One is phytolacca, second is Rostox. Because by putting what? That fine element which was last, okay, of the patient, which is differentiating from the others. It is all the rheumatism appearing to per se. Is it? That's it. See, concomitant ka meaning. Accessory, that is the Hahnemann said. Accessory, that is us coming together, or in the case so far, so long that even patient may not be saying it to you clearly, but you have to find it out. Now that the first case which I said, he was having redness, he was having joint pains, he was having deformance. So modalities and the tissue affected. That made it a concomitant. That made the actual prescribing one. Existing together. The other one, how to recognize this concomitant symptom, these are the symptoms. Occurring together. Attendant symptom. Attendant circumstances also occur simultaneously, and unreasonable attendant for others. For patient, it may be, for allopath, it is unreasonable attendant, and that is concomitant theory. So this is what the concomitant. Next, concomitant symptoms to the totality, the whole case of the disease, what the condition of aggravation and amelioration is to single symptom. So whole case can be picked up. It is the differentiating factor while considering appropriate remedy of the case of the sick. This is what it is. Next, concomitant symptoms are individualizing feature to each case, more often found in some modality. It may be found in modality also. Common to all the symptoms of the group. It may be generalized modality. The group of the more important than the single symptom. Next. Yes, this is what it is. It makes you concomitant symptom at all. Got it? If you can make it this one symptom complete, you have to make that symptom complete. Now where are we coming again back to our college days? We have been taught location, sensation, modality, and last part which is not introduced into our practical clinic, and still we are not using it clearly. It can be made from the different way. This is how the concomitant was made. Now this system went into the background little because of the Herring's remark, which ultimately Herring has also following the same way, that it cannot be generalized too much. Because Herring has said that every case cannot be generalized. But I find practically when you do this, this is the most important way of doing it. Apply concomitant. In acute you get it very clearly. For example, I have a child may be coming to us with tonsillitis, for example. What do you see? Pain in throat. They may say, or they may come just with a high fever. When you see and look into the throat, it is full of pus. But child is gulping water. Maybe easy to eat, not a problem. What may be the remedy? Where is the sensation?
No, opium.
Exactly. Why?
Painless.
You have converted that. So that becomes concomitant, and that is why it has to produce result. Get the example now. So you have to convert that and make the application. That you can say even keynote of that particular remedy. When you see in the patient, it becomes very easy. In acute it is easy. But if you like the same thing in chronic, you may not get, because there are multiple complaints. Even as he said, the patient may not forget, patient even forget that I have this complaint. They consider that as a part of their complaint, routine. Yes. Fine. These are the two cases that we said, that is third. And secondly, one was the phytoleca, that is what we said. Third, which is very common and which may be very useful to you, that very typical some certain joints are there involved in certain remedies. Can you recollect those remedies? Joints, certain joints are more affected. What is the ledum? Ledum.
One is diagonal opposite joints.
Yes, but the ledum ka major is the gratto, more at night, typical arthritic, uric acid ka. And they said about eupatarium, because we have practically verified, eupatarium is nowhere. Eupatarium is used for what?
Fever.
Fever. What kind of fever?
Bone breaking.
Bone breaking.
Dengue or.
Yes. So even in chronic, when the patient comes with the rheumatism, severe aching pain, cannot stay in one position, restlessness, severe pain, pain out of bounds, unendurable bound, it is eupatarium only. But in eupatarium, to differentiate when to give eupatarium, only one indication, which is given only one place, and that is in Allen's, and that has been producing surprising results. I have started using after application of this particular method, and that is affection of the joint, wrist joint, not the thumb and the base. See the anatomy very clearly. Not the patient either se aayega na. If it is not involving the wrist, it will not produce result. Only when, so I have the patient उसको बोलता हूँ एग्जामिनेशन टेबल पे जाने का, शी कैन नॉट पुट दिस हैंड लाइक दैट, शी क्लाइंस विद दिस, फिर आएगा ऊपर, शी कैन नॉट यूज दी रेज जॉइंट, वेरी क्लिनिकल नाउ, बिकॉज दिस डजंट हैव पावर हियर, इफ शी पुट्स देयर इज अ लॉट ऑफ प्रेशर एंड लॉट ऑफ पेन एंड देयर इज अ स्वेलिंग हियर, and this is invariably giving results, 100% results. Jupiterium. See why? Because I started applying this approach. Jupiterium was never applied for rheumatism. I used to apply only for that fever. Fine.
So in chronic cases or just
Chronic,
chronic
proven case. RA is very high, 300, 400. Chronic case, but wrist has to be there. So about 2 months back, one of my old patient came back with the severe swelling of the wrist joint. Only one, very rare. Unfortunately, we don't have the records, otherwise it would be very convincing. First time life में wrist joint से चालू हुआ. He was around 50. Is it around? Samir Shah?
Yeah, 50 suddenly.
Suddenly, without any thought, he just gave repeatedly. Within, when he came after a week, there was no
Next day
swelling.
only he was better.
Yeah.
He called.
So next week there is no swelling, no redness, pain is gone as if nothing has happened. So we just asked him how many days it has gone. पहले दिन थोड़ा हुआ, second, third day पूरा निकल गया. Within couple of hours, and such a violent, severe, so much so that I said what to do in the acute में, तो बोला बैंड लगा के रखो, wrist band मिलता है बाजार में, बैंड लगा के रखा, that's fine. And with the only Jupiterium perfoliatum, without study of Jupiterium, without this approach, giving some clue or light, I would not have given Jupiterium. You don't know. So if you know how to apply that concomitant of that remedy, again we will go back to the rheumatic part. Then you will realize that how to apply that rheumatism. Simple. Why the location and any time. Now the next is here. Every case of rheumatism, for instance, will present certain symptom in common. That is diagnostic इनको rheumatism है. Next. Besides this common symptom, each case will present what Hahnemann calls uncommon characteristic symptom. Uncommon and characteristic symptom. So in why the rheumatism I am saying the application, see, these are the very, very bad cases. Nobody had success. Like one abdominal muscles, and phytolacca is useful in muscular rheumatism. Very much useful. Phytolacca का दूसरा use, if anybody says, throat, breast, and third is this rheumatism. Excellent remedy. So rheumatism in the abdominal, that is one. Iridocyclitis you saw, and third is this Jupiterium का wrist. But wrist has to be there. Pains are same. Rheumatic pains, Rostow's का pain, सब pain same रहता है. If you read the phytolacca, the Nash and the Farrington says it is between Rostow's and Bryan. How to decide that? Very difficult. So to decide that, the pathology has to be understood very well. How to be done. हाँ, बात करी थी मैं. हाँ, बात करी. So that individualizing factor, as the Hahnemann says in 95 aphorisms, you pay attention, you read 10 times the aphorism and you can read the TPBs also. That is the which represent the individual factor. That individual factor is the remedy. So phytolacca, Jupiterium perfoliatum, and the Rostow's. Rostow's may be well known, but the iridocyclitis may no other remedy. What are the grand feature of Rostow's? If anybody can tell me. We know only pains. Modalities and even the pathophysiology. As I said, by proving what they were doing, pathological understanding of that remedy. Pathogenetic power. So pathogenetic power of Rostow's is erythema. Redness. Even if this vesicle comes, it is also useful in very bad cases of herpes. Exactly. Herpes, cellulitis, and the rheumatism, iridocyclitis. That iridocyclitis is so bad pain, it is very difficult patient to bear with that. And these two red eyes, such a severe pain, not relieved by anyone biological and steroids. And that is the differentiating feature. So going back again, first line, LSMC. Going back where? एकदम simple. होम्योपैथी में कॉम्प्लिकेट करने का जरूरत नहीं. Very simple. First year of the student life, we are learning this. Finish this. 4. Somewhere, एक जगह से एक लिया, दूसरे से दूसरा, तीसरा, मगर एक symptom बनाओ, and that is the remedy. वेरी सिंपल, बहुत ज़्यादा फिलोसॉफी में जाने की जरूरत नहीं. एंड दैट इज बीन सेड बाय Hahnemann, that is adapted by Harry, that is been adapted by Boeninghausen, and after 100 years by Alice. How much proof we want? How much support you want? How much proof we want now? And after that, what I say that I have used and we have seen that Eupatorium, unbelievable. So what we have to do, whenever you find, make the concomitant, go to the materia medica. Because that is why I am saying, phytoloca ka use kiya. We were not knowing the rheumatism part of it. So book में materia तो पढ़ लेते हैं, but once you find that, you go back to materia medica. Why? The success lies there. हमारा fighting power क्या है? हमारे पास gun है तो materia medica. You have only one weapon with you, and that is perfect materia medica. So materia medica is nothing कुछ ये not from periodic table, isn't it? Anybody has the experience of periodic table का?
So during college days I used to do that.
Yeah, but the materia medica derived from periodic table.
Couldn't understand.
Yeah.
Well, the differentiation was so very fine between first and the second element. It is
So I'll tell you the beauty of it. I went through the book. फर्स्ट पेज में भी देखा, थोड़े बीच बीच में रेमेडीज सब लोग फैंसी में बोलते हैं ना, कैलकेरिया का डिफरेंट तीन चार नाम. इट इज़ नॉट कैलकेरिया हाइपोफॉस्फोरिका, कैलकेरिया सिलिकाटा, अम्बिलिकाटा, सम डिफरेंट नेम. So end of the book that Ian Sultan writes, I have not practiced homeopathy. This is because of periodic table. I am combining these rubrics from here and putting on paper. That's not the materia medica. That's not pathogenetic power proved on patients. That is hypothetical materia medica. And the newer generation of the homeopathy is after that materia, which their pathogenetic power is not known. He has written very boldly and frankly, I do not know materia medica, but I have written this materia medica by combining these salts and writing it here. Periodic table. Absolutely theoretical, speculative, fabricated materia medica. You can't rely on that. You rely on Allen's की नोट, पढ़ने को बहुत टाइम जाता है. लिपेस, एलेंस की नोट में दिया है, लिपेस में दिया है. The rheumatism of wrist joints. So that is how the one after another. That is how I wanted. I mean, you have any experience to share of this concomitant theory, or anybody of you have other than our clinic, their privates? You were saying anything?
I had a patient, a very old patient. Suddenly he came limping to my clinic. He is in his 50s, and I observed huge swelling at his ankle. He was almost limping, and he was in very bad acute pain. So whatever we had practiced, and we learnt colchicum recently, so I just applied colchicum on that basis, rheumatism and severe unbearable pain.
Yes.
And the next day I had a message from him, thank you doctor, my pain is almost gone.
That's the fast acting remedy, colchicum, and you can't believe it. We were knowing it for what? Only one, nausea, food. It is excellent remedy for rheumatism. Why rheumatism I am stressing today? One reason, homeopathy will survive for another 1,000 years if they know how to conquer the pain. Pathology. If you conquer the migraine, people will be mad after you. Migraine, rheumatism, any pain, neuralgic pain, any pain. Because painkillers, nobody wants to take for long. Biological, nobody wants to take for long. And the steroids, biological, this combination of remedy, combos, that is 5-6 remedies, and every day to take in, take out. They know that consciously they are taking because they don't have any other options.
And they are very expensive also.
Very expensive.
The injectable ones are very expensive.
Very expensive.
14,000-15,000 per month.
Per month.
The cost.
Yes. So expenses I find, but expensive even when you take. They have to constantly monitor the liver and kidney to see that whether liver and kidney functions are getting deviated or not. So if you can conquer the pain of patients during, and that is the only rewarding point. If I am in a pain and if you relieve my pain, you are the doctor. What pathy you do, I don't mind. And you are giving such simple medicine. मैंने बोला हर घंटे पे लेना. Yeah, doctor साहब, and the results are, what you can say, gentle, mild नहीं. एक another word has come into it. Imperceptible. As she said, next day my pain is gone. समझ में नहीं आया कैसे ठीक हो गया. Next day सीधा चलता है. Imperceptible.
Pain also had gone.
Imperceptible. That is the speed of homeopathy. Imperceptible is a magic. So if you can treat the pain of the patient and such autoimmune diseases, such crippled pain, definitely there are advantages there. But if we can master this, nobody can come close to us. It can survive. मगर हम लोग ये दिशा में गए नहीं. कभी हमने importance नहीं दिया कि पेन के पीछे जाओ. Like go for after the pathological understanding of the disease and clearing it off, and that will give you the reward. That's what I want to say. If you have any ideas or stories, you can say, or you have any questions, let me know. The concomitant, and again going back to our roots, but unexplained root, in not applied practically roots, and how to apply that theory into practice. Hahnemann organon came when, if you have any idea, 1808 or 1810, for example. But he has written when? After going through practical understanding of homeopathy. So we take it as a theory. It is not theory. It is the practical experience and then laying it down into the organ. It is a practical book. It is a book of practice. How you should practice, he has given it there. How you can find the results, how you take the follow-up. Today I have not given you the topic will be how to take follow-up. Decode. The follow-up, I'll give the, if you can read and come, aphorism 200. If you can put. Decode karke out next time. Let us see if you can decode and let me see. 200, you have the book? Yeah, read 200. Next we'll go for it. Now today we have taken how to take case, or maybe next time we'll go further, how to take the case from the same what we have. No schema, no change. कोई बड़ा बड़ा साइंस नहीं, कॉन्फ्रेंस वाले सब कुछ बड़ा चढ़ा के बात करते सारे. 200.
Had it still been
Because I said in advance that it will be follow-up, and if you study that and come, then it will be more enjoyable to understand what is the follow-up. Homeopathy maybe you have to examine patients. That is what he's saying. You have to get up from your chair. You have to examine each and every patient. 200. Yeah. Here it is.
So had it still been present to guide the internal treatment,
Then that word.
the local effect.
हाँ. वही तो crucial है. है वही. ना थोड़ा वही. Yeah, fine.
The homeopathic remedy for the whole disease might have been discovered, and had that been found, the persistence of the local affection during its internal employment would have shown that the cure was not yet completed. But were it cured on its seat, this would be a convincing proof that the disease was completely eradicated and the desired recovery from the entire disease was fully accomplished, an inestimable, indispensable advantage to reach a perfect cure.
Yeah. My whole follow-up of every patient starts here. He has given you complete guidance that how to take follow-up and whether your medicines are acting or not. ये तो बहुत बड़ा question है. You ask any senior most, बता ही नहीं whether my medicine is acting or not. He has given a clue here. So decoding this 200, read, and whatever confusion what you have or queries which you have, you will solve it that time. Whether, question is what? Whether my medicine is acting or not, whether it is leading to,
Perfect cure.
what do you mean by perfect cure? What is it? It is, so these two, it's a decode. We'll do the decode of 200 and that will be follow-up in homeopathy. We have taken the case, we have seen the results, but a follow-up देखने का कैसे? He has seen here. And what are the advantage of following these masters and not following anybody in between? Anybody. Nobody in between we have to follow. And what is the advantage we'll go through tomorrow. And the next time. Maybe you will get the intimation on your, maybe 15 days after. Let it be. Fine? Thank you very much. If you have any queries. No? So you have understood the topic. Very well? Concomitant. The idea of concomitant. The book is fully there, and the last bibliography you will see. So what we say and how we got it, you will see that last. That what are these authors are here. Yes. So we did that in the aphorism 95, and this aphorism is mentioned by Herring in his guiding symptom. First, that how he solves the case, how you need to solve the case. He has given here in Herring's guiding symptom, and the Boeninghausen that we have been constantly referring to. He is a constructor of concomitant, and exactly transpiring what Hahnemann used to tell us and how to make the concomitant. Then the Herring's Materia Medica, that is what I was referring to. And lastly, it was amply example, this repertory or the book of the TPB, what you say, is been enlarged, edited by a very grand level and a great level after 100 years by the TFL. And that was a masterpiece. And that is still existing, and after maybe say 150, 75 years, we are using it the same way. These are the 4 authors which we